All right, so I want to explain how the body works from the Chinese medicine perspective.
我想解釋下即係中國即係呢個藥物嘅點樣運作嘅。
So we have several things that compose the body.
幾樣嘢咧就係加埋喺個身體啦。
Qi,
氣啦，
which is oxygen and energy.
其實就係養分同埋氧氣嘅。
And so would you say that we need oxygen and energy for our body to work?
咁啊，你咪即係需要養分同埋氧氣先生存咧？
Probably yes, right?
當然係啦。
And so the oxygen is carried by the blood.
咁血呢個氧氣就即係用經過血去循環啦。
And blood is a liquid that flows through the body, starting at the heart.
咁液體喺身體度流啦，係由個心臟開始啦。
It goes to the lungs and then back to the heart.
去個肺，然後翻個心度。
Then it travels all the way out to all the fingers and toes, all parts of the body.
咁啊，去到所有腳趾啊，所有身體觸覺部位嘅。
And the blood provides the food and the nourishment and the oxygen for the cells to work right.
咁啊，血就帶嗰啲養分啊，同埋呢個即係營養啊，就去身體各部位啦。
As we were talking about, the blood circulates through all the organs in order for them to work right.
咁啊，講即係血液即係去到即係身體各部分，令到身體運作自如啦。
So on the way back from the cells, it is filtered by the liver.
咁啊，翻嚟嗰陣時咧，就俾呢個肝就過濾嘅。
And it goes through the kidneys and filtered by the kidneys.
咁去過個腎咧，亦都係俾個腎去過濾嘅。
And it goes through the small intestine and picks up nutrition.
去小腸啦，就即係吸收營養啦，帶啲營養翻去嘅。
And eventually it goes back to the heart.
咁然後翻個心度啦。
And it continues the
咁
circulation.
啊，繼續嗰個循環啦。
Now, the blood and the oxygen also have to get to the brain and the spinal cord for them to work right.
咁啊，當然啲血液都去個腦同埋呢個脊椎度，令到身體即係可以運行啦。
Surrounding the brain and the spinal cord, which is the central nervous system, CNS.
咁呢個腦嗰個即係包圍個腦咧，就叫做 CNS 咧，就係呢個神經中樞嘅。
Are 3 membranes,
有3個膜嘅，
sort of like plastic wrap.
就好似啲即係廚房嗰啲咁嘅即係保鮮膜咁啦。
And all the blood and the other fluids to the brain and spinal cord flow between those different membranes.
咁嗰啲血啊養分就係即係流過即係嗰啲膜嘅中間嘅應該。
And if there's any blockage in those membranes, the brain will not get the blood and oxygen that it needs.
如果有阻塞嘅話，個腦咧就攞唔到嗰啲養分同埋呢個氧氣㗎啦。
So symptoms and other kind of disease can happen when the meninges are also blocked.
咁如果即係呢個症狀同埋呢個疾病咧就可以產生，因為個即係運行唔到啦。
So something like a stroke
好似中風啦。
is a condition where there's a blockage in the flow of blood to the brain.
咁就係啲腦就即係運都唔運唔上個腦度啦。
And sometimes the entire side of a person's body will no longer work properly.
咁有啲人咧就半身都即係半身不遂啦會。
And their hand can curl up, and it's hard to walk, and they cannot speak properly.
咁咧即係手啊即係扭曲晒啦，即係揸埋晒啦，咁又行都行唔好啦。
So that is an example of when the blood and oxygen is not getting to the brain as it should.
咁啊，即係一個啲血去唔到個腦嘅後果啦。
However, if the body is working properly,
但係如果即係身體運作住嘅話咧，
then the oxygen gets to the body.
咁啲血養分咧就唔係呢個氧氣就去到個身體啦。
The nutrients get to the body from the
營養
blood.
亦都去到身體啦。
The organs produce hormones.
個內臟咧就係即係做呢個荷爾蒙啦。
And the central nervous system produces the messages that control the body.
咁個神經中樞咧就係
Messages. So it produces messages that the nerve impulses that control the body.
咁啊俾啲信息個身體各部分啦，亦都俾佢即係控制身體各部分啦。
So when we have enough oxygen and enough blood of good quality,
咁我哋一夠氧氣同埋即係啲養分夠嘅話咧，
flowing without any blockage to the organs and nervous system,
咁就即係運到去身體每個部分啦。
then our body works at what we say is 100% function.
咁即係可以就話呢個身體嘅運作就係100%好嘅。
And 100% function is what we call health in this practice.
100%運作好嘅咧，就係我哋嗰就係健康啦。
When we have 100% function, we have ease in our body.
咁如果係100%運作得好咧，佢就要叫做 ease， 就係即係身體運作得好自如啦。
So it is easy to fall asleep at night.
話瞓覺就易啦，好易瞓着啦。
It is easy to wake up in the morning with lots of energy to do what we need to.
一起身就好多精力啦。
It is easy to eat food and digest it properly.
咁食嘢又即係吸收咯喎。
And it's easy to move without any pain or restriction in our joints.
咁你喐嘅話咧，即係啲手教嗰啲就冇痛嘅，亦都好自如咁喐動咯，可以。
That is when we're at 100% function.
咁呢個就100%嘅運作自如啦。
However, we live in a world that has stress, that has trauma, and has toxicity.
好可惜咧，即係我哋呢個生活咧有好多即係創傷啦，同埋即係緊張啦，同埋呢個毒素嘅。
And the stress, trauma, and toxicity cause blockage in the flow of oxygen and blood in the body.
咁嗰個3樣唔好嘅嘢咧，就係令到即係我哋阻止我哋啲血係即係運行到我身體各部分嘅。
In Chinese medicine, we call that stagnation.
中藥嚟講咧叫滯留啦。
And stagnation decreases the function of the body.
咁呢個滯留咧就即係令到我哋身體運作冇咁自如喎。
So when we have stagnation, it blocks the oxygen to the body.
有滯留嘅話咧，就即係氧氣去唔到個身體啦。
It blocks the nutrients going to the body.
營養又去唔到身體啦。
It alters the hormones getting to the body.
咁啊影響呢個內臟製造呢個荷爾蒙嘅運作啦。
And it changes or blocks the messages going to the body.
咁呢個中樞神經俾嗰啲信息個身體，你亦都係即係去唔到咯喎。
So the body no longer functions properly.
咁個身體就運作唔自如啦。
So over time, the functioning of the body decreases.
咁久而久之咧，嗰個身體運作係一路減嘅咯喎。
So here, if we have lost 20% of function,
冇咗2成嘅即係運作效率咧。
Because of the stagnation,
即係由於呢個滯留嘅問題啦。
instead of 100% function, we start having dysfunction or malfunction.
咁即係運作唔自如啦，即係。
And if we continue to lose function because of the stagnation, it blocks the flow of oxygen and blood, then we start developing disease.
咁再多啲，即係多2成嘅話咧，就開始有少少呢個疾病嘅喎。唔係，對唔住，唔係疾病 correction， 係即係呢個身體運作冇咁容易啦，冇咁自如啦嚇。
And if the stagnation continues and we have not cleared the stagnation,
咁呢啲滯留我哋唔即係搞走佢嘅話咧，
then the function continues to go down, and when we lose another 20%,
咁啊身體嘅運作咧就再唔見咗20個百分比嘅即係運作。
in other words, we're at 40% of functioning.
即係換句話，即係4成就係運作得好嘅啫喎。
That is when symptoms occur.
咁啲症狀就出嚟嘅咯
And so individuals who have work injuries,
喎。咁好似話啲人有工傷咁話啦，
the work injuries we see are usually from a trauma.
工傷通常都係一個即係受創嘅係。
It can be overuse trauma,
好似即係用得太多啦。
or it can be a slip and fall kind of
即係
trauma.
話跣到跌低又會啦，即係呢個創傷啦嚇。
Or there could be some other kind of thing that causes an injury to the body.
咁亦都有其他原因可以令個身體受傷啦。
So people come in with symptoms usually, and those symptoms might be things like pain.
即係好似如果你即係有呢個症狀嘅話，即係例如話係痛嘅話，
Or numbness and tingling,
可以話即係針刺麻痹嘅感覺啦。
or restriction in the movement
咁
of
可
the
能
body.
喐得冇咁即係喐個幅度唔係咁正常咯
So in order to treat that,
喎。嗱，想醫呢樣嘢咧，
then we need to remove the stagnation,
咁啊即係攞走嗰啲呢個攞走呢個滯留啦。
and we need to remove the stagnation and then to improve the function.
即係亦都即係攞走呢個滯留啦，同埋增加呢個身體嘅運作嘅。
So some of the symptoms other people might have include pain,
咁即係其他嘅即係症狀嘅話咧，有痛啦、
insomnia, which is
Insomnia.
difficulty falling asleep,
失眠啦
And PMS was this premenstrual syndrome. It's women before their menses, sometimes they have pain or emotional disturbance.
即係通常 PMS 咧就係女士咧，即係月經之前嘅，即係瞓就瞓得唔好啦，同埋好即係個人好即係好唔開心咁啦。
Bloating,
即係積水
like
啦
they,
嚇，個
people
肚
swell
脹
up,
咗
and
啦，
weakness.
冇力啦。
So, there's two kinds of treatment.
兩種治療方法喎。
One is called relief care, RELIEF, relief care.
第一個就係即係叫做直譯就係釋放嘅即係釋放啦叫做。
And relief care only deals with symptoms.
呢個咧淨係即係可以搞掂個症狀嘅啫喎。
That's like taking aspirin or painkiller.
好似食阿士匹靈啊或者係止痛藥咁啦，就係咁啦。
However, if we're dealing with the underlying cause, which is the stagnation,
咁啊想即係搞掂基本嗰個即係滯留嘅問題咧，
we do corrective care, which is to correct the underlying problem.
呢個要改正嘅方法啦用。
So in workers' compensation, usually they're most interested in getting rid of symptoms.
呢個工傷通常就即係搞掂你嗰啲症狀就算數㗎啦。
So after we've gotten the symptoms decreased, usually that's when they say, okay, that's all.
你啲症狀冇㗎啦，好嘅搞掂㗎啦，佢就話你。
That workers' comp will pay for.
咁就係咁，即係嗰個工傷院所就係俾呢啲嘅啫。
Some of the stagnation and things may still be remaining, but that's not something that they will pay for.
嗱，通常滯留喎，即係其他嘅問題咧，佢就唔理你㗎啦，佢就唔俾錢㗎啦。
Okay, so thank you for helping me explain that.